Preparing for a physiotherapist interview? Here are 3 common questions and examples of how you could answer them. Question 1. If a patient refuses to follow your recommendations, what would you do? Here is what you could say. I would ensure the patient understands why I've made the recommendations and the reasoning behind those decisions. If they still refuse treatment, I'd calmly advise that they consider seeking an alternative physiotherapist better suited to their needs. I would do this respectfully to avoid upsetting or offending the patient. Question 2. If you're treating a patient with a broken limb, what are your recommended exercises? Here is what you could say. The first step would be determining their range of motion and flexibility. I would then develop an exercise plan based on that assessment. For example, for a patient with a good range of motion but limited flexibility, I could focus on stretching exercises. If a patient has a poor range of both motion and flexibility, I would recommend strengthening exercises. Question 3. How often do you recommend patients perform stretching exercises? Here's what you could say. My recommendation to patients is to stretch for 5 minutes daily. I'd encourage them to write this down in a planner to remember. I'd explain that stretching aids recovery by increasing blood flow to the muscles, leading to increased flexibility. I'd also inform them that if they stop or don't do the exercises, they're likely to see little improvement in their condition. By preparing your answers to these questions, you'll be ready to impress in your physiotherapist interview. Good luck.